But let's continue. We are moving on to healthcare cybersecurity in the era of digitalization. Together with Pius Eva, doctoral researcher in information systems science at the University of Vasa. Healthcare organizations around the world are facing escalating cyber threats, resulting in significant breaches of digital health data, which puts patient safety and privacy at risk. Pius's presentation discusses how critical infrastructure lacks cybersecurity integration in its design, and his research proposes a proactive strategy to reducing data breaches, identity theft, and to protect patient information and safety. Please go ahead, Pius.
Okay. I think I have this one. Okay. Thank you. Thank you. My name is Pius. As we said, I'm talking about is your health information safe or is your information safe? But one thing is a yes or no answer. Yeah. But then there are some protocols. I would firstly say thank you to University of Vasa for this opportunity and the Finnish Cultural Foundations that also supported this research. So I would want to say thank you to them. And then as I proceed, yes, health information breach. Like I said, many organizations are facing a rising number of cyber attacks, which has resulted in information breaches, and which is quite key in protecting organization critical infrastructure. So what is cybersecurity? From the HIN's definition in 2021, which said that cybersecurity can be defined or termed as a method of protecting health information from unauthorized access and disclosure. Yes, and one thing that's built about cybersecurity in healthcare, it's all about the confidentiality, availability, and integrity of information. So how are they? Is the information is confidential? One, we need to look at it from that perspective, that information, sensitive information should be confidential. And two, we need to look at that integrity of data, that data today that being keyed in the system should be seen the same way from point A to point B. And it's not modified, it's not falsified. So we need to look at the availability, that in the sense that data must be available. For example, today, people have you have something like the OMA counter, or something that the patient or prospect patients are using. So in that sense, that you should be able to access your data. You should be in your healthcare journey. And then we now look at, let's dive in straight to healthcare digitalization. Digitalization through the Internet of Things, Internet of Medical Things, has made this possible with the help of the IoT devices. And that's in the sense that look at how this digitalization has revolutionized healthcare, in the sense that people can access information from different data points and locations. But the Internet has made this possible. And this digitalization as well has also driven for diagnosis of healthcare services. Today, you see people install a medical app in their phones, and that app will be able to tell you, okay, you can check your blood pressure, it can be able to check your ECG. So, yes, it's the digitalization, healthcare design. These have made it possible. And then to manage care from error-free, because human also could be sometimes vulnerable in the sense that, but with the connected system, we call it what we call today the connected care. The connected care is about the Internet of Things. It's about digitalization process in healthcare processes. So we go by now. This purpose, in the sense that of this research, has looked at it to motivate that empirical need in making sure that health information is secure. Yes, and then from that, this does not start from the blues. In spite of this issue, there are what I call a complex socio-technical problems. And the complex socio-technical problem in the sense that looks at the technological factor and looks at the human factor. For example, the implication in practice can be as increasing breaches of health information, and whereby the threat to patient safety and privacy. Increasing cyber attack that you can see most organizations today are going bankrupt. Most of the organizations today are facing legal issues. The General Data Protection Regulation, they are also there that ensuring that if data information is breached, and you know what happened. For example, in the United States of America, you can see they have the Human Health Services, which they ensure that each data breaches must be reported. And that otherwise the organization face a difficult penalty. And that's in the sense that, according to the North Georgia, that every day, 44 health information record is stolen in every second globally. And then, from the Verizon Data Breach Report, you can see also highlighted that 90.8% of these issues are human elements. Let me tell you one thing. Even if that technology, computer systems are patched and is effective, that 98, 99% is accurate with the technology. 1% of human stupidity can cause a serious problem, yeah. And that is why it is fact that the human factor must be human must be educated, human must be aware, human must be sensitized. So most of these problems, it does not just happen like that, but there is something that drives these cybercrime and breaches. Yes, in that case, we have like the personal health information is gold in the dark web. People sell personal health information at the cost of 380 to 1,000 euro. Yes, in the USD in the dark market. And that's because there are people who are involved in this. These are state actors. These are non-state actors. The state actors, these are the people that work with the government of different countries. Like today, you heard about issue, allegation, counter-allegation, China accusing United States accusing China, patent infringement, privacy breaches, spying, all these issues. These are state actors. Because why? They are looking for controversy over the digital space. Who is going to take charge of the digital space? Who is going to be the king in the digital space? And that is why that all this cyber espionage, identity theft is going on. And we look at from the perspective of the non-state actors. These are organized crime, organized cyber professionals, criminals that are hijacking critical infrastructure, health information, with what we call like the health information ransomware, which is ongoing and is on a prevalent rate. It is significant that it's happening globally, that in the sense that some will use a malicious code like what we call crypto locker, which is being embedded in the Bitcoin activity, that they hijack critical systems and that sense, and they demand for ransom. So these are some of the organizations that have witnessed this kind of attack. And like, for example, the National Health Insurance Scheme, that over thousands of computers were infected over in 155. This is a WannaCry attack. Another one is the malware phishing attack, which is the Hollywood Presbyterian Hospital that has to pay a large amount of money for them to gain back their information because it was through just an email sent to an employee, and then they click on the link, and then they get infected. So that is why a case is also one in Finland here, which is the Vastimo. You are aware of the case as how it is, and some of these criminals were demanding 40 Bitcoin, which is up to what? 450,000 euros, in the sense that otherwise this information will be exposed. And you know what it means when this information is exposed in the public. The GDPR will come for you. And they will say, oh, the individual patient will sue you for making their data public. And that's a critical problem. A lot of organizations have been going bankrupt. And some are facing legal charges. And that is why it's key to protect critical information and health information. So I will move to what I described. Why are these breaches in the first place in organization? And this is factors in the problem area that I said that is a technological factor, in the sense that inadequate data encryption, afterthought, security was like when data is not properly encrypted, any person can see that information. And also, afterthought in security, in design, that today, if you're a designer, if you are a specialist or security expert in an organization, you should ensure that security is built from the beginning of technology. And that also, we look at third-party software. Today, that softwares are not just only, we have software as a service, we have hardware as a service. Hardware is proffering, solving issues. Software as a service like intelligent application software, which you have like the medical apps, they are also sensing information from you. They are also processing information. So they should be classified in the sense that software as a service and ensuring that third party meets up to the regulatory standard for National Institute of Science Technology to ensure that from the pre-stages of a medical development system life cycle, in the sense that they meet from the pre-stage to the post-phases of that technology, and they should ensure that it's being certified before you can plug it in design process. And also, we need to look at the endpoint complexity, that Internet of Things, the employee personal devices, the Internet of Things are virtually, the Internet of Things are connected to the Internet of devices. You can have the implantable devices. Today, people have the pacemaker in their hearts. They have MAC address. And also, they have RFID, which is radio frequency. And if that is not properly protected or off from the radar, it can be hacked. And they are vulnerable to attack. And also, we look at investment is critical because you need to invest in cybersecurity. According to the research we have conducted, we found, and from the literature, that most healthcare organizations only invest 3 to 5% in security, and whereby all the energy is channeled on delivering care. But what happens if one data is breached? That's catastrophe. And also, we need to look at partnership because people having technology need to partner. And then, our legacy system, you need to phase out old legacy system. You need to improve human factor challenges, human error need to be tackled, insecure behavior, and need to be tackled as well. And then I build a framework model around the problem that, in that sense, there should be technological factor, implement blockchain, request security in design process, and also ensure that technology has a lot of audit tray, and then also ensure from the network endpoint devices that you need to have network solution. And also, you need to ensure that these systems are actually not complex, are disaggregated, and be simple in designing process. I also conduct security training awareness to know the level of consciousness of human. And then this can help in the essence so that organizations are met cybersecurity hygiene and create awareness for backward and forward integration. And then also need to phase out legacy system and be compliant with that of the NIST framework and collaborate with higher institution research organization to ensure that you are properly resilient and you are protected. And then to ensure that you increase investment, partner with expert institutions, improve by having a cybersecurity unit in your organization to protect critical infrastructure, ensure the necessary standard of ISO IE 2700 that standard is there. So human, prepare to protect your critical infrastructure, medical device, ensure that you have the necessary cybersecurity hygiene to be resilient and to protect your critical infrastructure, which is quite key, and ensure that when you're procuring devices, that these devices have security in design or has a support. Thank you.
All right, thank you so much, Pius. Do we have questions in the audience for Pius? I'm at least curious to know if, is it a lack of funds that are the main challenges of implementing better cybersecurity, cybersecurity hygiene in health organizations, or is it something else as well?
Yes, actually, it's not just that lack of funds actually contributes, yes, because most organizations does not have that capability to improve, but then it has to be a culture in an organization. Organization that want to protect, want to process information will need to know that there is the GDPR, there is people that is going to come for them if they breach this data. So they should be prepared to have that capability and ensure that they improve and increase investment in technology and in human. These are basic key in running an organization and developing systems that you will use for organization to protect or to process health information. And that is key.
All right, so both a culture and the regulation needs to be there.
Yeah. And then also they need to have the compliance officer to work with them, to guide them, so that in case when they are going away, they should be known, she should put them back on track on what to do, that they are operating on the regulatory standard that is required to administer secure healthcare services. And that is key.
All right. And what about us as individuals? How should we protect our own healthcare data? Is there anything we can do ourselves?
Yes, as an individual, you have the right first in the first place that you need to ensure that either you're giving in your data, there should be a consent. That in the sense that the GDPR allowed you to say that, okay, that you need to have that consent, either you opt in or you opt out. And even the system developer should need to be that you need to know there is an opt-in and opt-out before you opt in the first place. And also, you need to ensure that you see malicious link as an individual. You don't have to click on malicious link, but you need to know the source. But if you can do this in the sense that you can also have something like, you can take this link and put in the browser, like in the Google, and say, okay, analyze malicious link. There are some tools there online that can check the link for you if it's malicious or if it's not malicious. Then before you can click on such link, and you need to know who is the sender. That's as an organization.
So being aware.
Awareness, yes. So you have to be aware, you have to be sensitive, you have to be alert, and to know in your digital walk around to ensure that you're safe. But if you're also buying like a smartphone, you need to ensure that the smartphone you're buying, that it covers security. You need to ask the provider, whoever you're buying the phone, that this phone, what does it support? Like today, you can see people have F-Secure, you can see Digitalisation. Yeah, so all these are key in ensuring that when you're using smartphone, and you also need to ensure that you make sure that if you're using Windows 10 and they have moved to Windows 11, upgrade, because otherwise you're prone to be hacked.
All right.
Yes.
Any questions in the audience right now? Let's see. Are there healthcare organizations that you can give us examples that are actually pretty far already or advanced already in their cybersecurity practices? Do you have any good examples for us?
Yes, in that sense, there are a lot of organizations. Even here, also, there are quite numbers of healthcare organizations here in Finland that are actually advancing their skills, like in terms of this. But I wouldn't want to promote one particular organization in that sense. But then HIMSS, if you can see, a lot of people are plugging to HIMSS. That these HIMSS have been people in the forefront ensuring these kind of activities in the hospitals that they cover. And like the HIMSS I quoted from them. So from further advances, you can also get in contact, whoever that want to get in contact, and then we can discuss further.
All right.
Yeah.
Thank you so much, Pius. Let's give him a round of applause. Thank you.